This is the I Know podcast where we all about healthy debate, honest conversation, and talking bare junk. Information, knowledge, observation. What do you think about QEH?
I think, from what I can tell, back in the day, it was probably a way better institution. And I say this. This seems to be a running theme around the Caribbean because the UE hospital in Jamaica, at a point in time, was actually the number 2 hospital in the world.
What?
Mhm.
That doesn't make sense.
Yeah.
What?
You can't just say that. You can't just say that. and it
So
be
I
true.
was told.
Yeah,
At a
that person
point-
was like,
Yeah, that
at a point in
that was-
time, it was a high tier hospital.
Like, the minutes
And
the
if you
different
look at
hospitals to
what
treatment.
it is now, you're like, boy, ain't no way, boy.
I'm not saying number 2 in the world, dude.
But I would say I don't know what went on. I can only speculate from
Mhm.
observing during my time there. I think it's very understaffed. I think they don't use their staff appropriately.
And this is Jamaica.
Just here.
Oh, okay.
Barbados.
Sorry,
Okay.
okay.
I
Yeah.
think resources are mismanaged. I think they try to do too much too fast without having good foundations in basic things. I think there's no legacy planning at the hospital. And I could go on, but
I mean, what I don't
yeah.
understand is how is there a saturation in the market, but yet
Because-
understaffed hospital?
because which I think is kind of stupid.
That's a good question.
For the lab, I'm gonna speak to when I was there. The hospital was trying to get accredited. So in the part of the accreditation was that you can only have a certain amount of staff to, I guess, a certain amount of people, like patients and stuff, which was backwards to me, right?
Yeah, I
because
was
you're
saying.
trying to impart a system that works in another country
Correct.
on us, right? I was like, that cannot work. But what happened? A lot of things in order to make the hospital probably look better than it was. A lot of things I thought that we should be hype, like even exaggerating to get the things we need. People were like trying to make it. It was like when your mother tells you people coming over, so go and clean up a little, but the people don't really care about what in your room, right?
Mhm.
You're just doing this to
Right.
placate.
So the
Yourself.
lipstick on the pig. What
Yeah.
they call? We can't see paint job, I guess.
Like I think people have heard like in the past, like you would hear stories of like when politicians come around to like have their tours of the hospital or whatever. You would hear like supplies coming out.
How we fill the potholes? How we fill the potholes?
Yeah.
Many prints.
And that
coming
was
or
like a
whatever.
real
Right.
thing, and I couldn't believe it. I was like, that makes no sense to me. Because if I have no tubes, I can show you I got no tubes, brother.
That's why you get funding
please.
for more tubes.
Yeah, I was like, please come and
Help
like
me, help
see
me.
how bad
I
things.
have no tubes.
Please come and see how bad things
So
are.
at one point, y'all used to just like pour the gauze
Yeah,
and
like you
like
reach
these.
points where you like,
That sounds
oh, that's a
very-
purple tube. Yeah, I'm gonna take 3 of these for myself for when I need them for my patients.
That sounds so foolish.
Yeah, I
right?
was
But,
like, there was no reason. It was like
his toilet paper.
everybody was fighting for survival to help people survive, and it was like this backwards thing. Like
it
I'm
genuinely
gonna
sounds
rob
so
you
foolish.
so that I can help the person in here to get help.
But no,
already.
you're a person frothing.
Yeah,
Because
because
the purple
somebody
tube's gone,
took the
B.
purple tubes out of here to help the other man out.
I know why that's so
A1.
funny. That's not funny, actually.
That's
I have a
crazy,
question-
though.
I have a question for you. We spent a lot of money on like to like have like free healthcare, all right? Well, free healthcare,
Which I
right?
think is a beautiful thing. They'll get me wrong.
But anyway, so whatever I was saying, that's not that. But I wanted to ask you the fact that we have we have a lot of for example, like polyclinics, and then we got the hospital, and then we got other things that are like we have access to free things, right? And by the way, I have no idea, so I just throwing this out there, right? It just seems to me as though instead of a lot of things not working like the best, why not pull resources from them, and then whatever is there, like have the resources
Should it?
to
Like a
have like
hospital
a state of the
megazord?
art.
they kind of
Like what? Like what?
Like,
What?
no,
they
nothing.
kind of
Like a hospital transformer? Yeah, like get all your
Sorry.
polyclinics
like
together and just
Autobot.
Optimus QEH.
It's also cute.
QEH Prime.
They
Give me
kind
his
of
frame, you can't.
they kind of
Oh
do.
my god.
That's kind of how it
I
functions.
want to know how you. I
What
want to
you
know if
gonna
you.
say
I
though?
want to know if you understand. If you understand
Yeah,
what I'm
it
saying.
kind
though.
that's how it functions in a sense. Like, let's say, imagine if the public health system was Voltron,
Right.
QEH is the main body that everybody sits down there, right?
Right.
Then you have the arms and legs, which would be the polyclinic. So you have like, your Sir Winston Scott, you have
Right.
Edward Cochran, whatever.
Right.
And it's kind of like a funnel system to kind of filter out stuff for QEH so that everybody doesn't come to QEH for minor things
Right.
that can be solved
Mm.
at the polyclinic. But then
Hmm.
obviously things that appear minor become major,
Right.
and they have like the only place you can go to get stuff is Q, and that is even in the private health
Yeah.
private sector, where you can only function in private sector up to a point. Like there's certain investigations, there's certain things that they cannot manage, and you have to be sent to the QEH.
I like
Okay,
that
so
you
but
said,
go
no,
ahead.
I was
Sorry.
gonna say, I like that you said that because like it never even occurred to me that like if I break my foot, I could go to the polyclinic, right?
For certain things, that's what
I mean, like I'm asking specifically about foot.
Mhm.
Because
There you
like
go,
I think that like I would think if I break my foot, I gotta go to the hospital for sure.
And that's what I'm saying for certain things and certain.
I wish that there was a way that the public can know. Oh well, you ain't dead and be like just go to the polyclinic, you're gonna be good.
So yes, I don't think people understand how it at the fault of the help. I don't think it's properly understood how things are supposed to
To work,
function.
okay.
Like nobody understands the flow because a lot of people show up and it's no fault of their own. They don't know what's going on with them. They just want help, and then we will have to tell them, yeah, A&E, but okay, this is a problem that you can actually go to Sir Winston Scott Polyclinic, and we're gonna send you there. And for them, it's frustrating because I now waited
7
so
hours.
many hours in this A&E. Sometimes people wait in their day for you to
Yes.
now tell me my problem is so minor I could went across the road.
So how can we alleviate all the issues that are in Annie?
I mean, it's not your fault, to be honest. Some people know better and just
But I
bypass
think
certain
at
things.
some point there's a mistrust too of those kind of like satellite clinics too.
For
'cause,
sure.
like, I ain't trust that. Let me just go QE.
But what is it? I don't understand the reason why we have the same mistrust in polyclinics, like because it's free. And if that is the case, I just find that
But
very
I
interesting.
think a lot of people have a negative connotation and mistrust of the QEH as well.
I don't.
Well,
yeah.
might I say I think that people generally have an aversion towards anything in Barbados that is public.
Yeah.
Transportation, public health, anything public, they say they believe it is mismanaged and that it doesn't work the way that it should. Also, I believe
And
that it's
think
held to a
that's-
higher standard because of the fact
that's
that we are
a-
taxpaying citizens and our money's going into there. So
And
the fact that
that's-
it don't work properly is kind of like we are more sensitive to when things don't go how the way we expect.
This is just 100% personal experience though. But like, it's just interesting who says so. 'Cause I remember when I got in this is years ago, I got in an accident and I got carried through an ambulance in an ambulance to the QEH, and to get there to sit down for 12 hours, and then to sit down in the room and the nurse cleaned my cuts and I was like, all right, go home. So like, that's just a waste of everyone's time. I did not have to be in an ambulance. Like, I got some.
Yeah, but okay. So I guess the ambulance man can't say man.
So like, when the
Right,
ambulance
and
comes here,
honestly,
like, look at you, B.
that is
Yeah,
that is also a thing. That one is more nuanced because the EMTs cannot, for certain things, they have to bring you there so that you could be assessed to say that you could be stepped down.
So why not carrying out the polyclinics is way studying? I feel like
That's a question, a liability question that I probably can't.
yeah. Sorry, I know you. I
answer
know you, Jay. I
Yeah.
can't answer that.
Because then it sometimes it's just like how laws are structured and what people could be held liable for that you want to avert for your staff. Because if you put your staff in a messed up situation, let's say you get in a car accident, right? at the time, EMTs think everything is okay to carry you to Sir Winston Scott, and then after a while, you start becoming drowsy, and then it comes apparent that maybe you hit your head. You didn't realize you hit your head, and then now you have a bleed, and or maybe it's happened very far away. Let's say you had an accident in St. Lucie, they carry you to
Right.
the nearest polyclinic. Now they have to find an ambulance to now get you to
From there to
QEH
QEH.
to get emergent care.
Which is more waiting.
Right? And then there might be a problem where there are no ambulances because there's so many things going on the island.
Right.
Which
And now
apparently
you
is a
kind
frequent
of,
thing.
you may get stuck and now have no way of getting the care that you need in a timely fashion to get the best possible outcome for you.
Mm.
So there are situations like that, which is it's just a tricky thing to manage.
To me,
But
go ahead. Sorry.
you could ask your question.
No, I no. All these things sound like more like logistical things, though.
A lot
Yeah.
of
It's more
no, like-
organizational.
right. It's just a trickle down effect.
Right.
Like so many things. My theory is things function well at a point. And like with everything else in Barbados, something went wrong. It might have been an easy fix if we did it properly. But somebody said, patch that up.
Mm-hmm.
We can get to that later. Or maybe they were waiting for something to get to it properly.
But
The
then
ball
They
something
got
else happened.
sidetracked.
Yeah.
And now it trickled. All of these things happened in a chaotic storm. And now there are patches everywhere.
The potholes.
There are potholes.
Literally, this is exactly parallel to potholes.
It's like you put marl in it,
Yeah,
you
there's
put
no
marl in it, and
connection.
every time there's a storm, it get washed away, and the sores are so apparent, and it's getting bigger every
No,
time.
I like paving the road, then to just dig it out after to put on the gas line.
Right,
Yeah.
right,
This is what we do.
right.
I played Bull Burst like the week after I get paid.
But it is kind of like the roads in the sense that you don't want to. There might be perfect, like that highway they're digging up, look perfectly fine to the naked eye.
Mhm.
But there were obvious engineering issues that are concerning, and now they have to dig it up, right? It's kind of like that where, yes, this is kind of functioning, but this needs to change. Like, you have to dig this up. You have to make this foundational change, or if you continue,
Right.
something bad is going to happen. And it's almost like everything in Barbados, to me, every major thing, nobody's willing to make that major decision to really revamp because it's too hard.
Right.
To disrupt.
Right. Because then that means you gotta start from scratch. You gotta go back to the foundation,
Nah,
then
but
rebuild everything.
Certain things literally
it,
want
need that.
burning and gone. Like, yo,
Yeah.
that
Yep.
cannot work. Not in today's
That was an
day.
interesting choice of words, seeing as the old hospital burnt down.
Wow.
Well,
You got
What
bars
are
for
you
real, boy.
now?
Jan, you got-
Yeah,
See how he did that?
call back. Yeah.
Thanks for watching the INO podcast, Information, Knowledge, Observation. Be sure to give this video a like and subscribe to our channel. We'll see you soon.